Kansas City, like so many urban centers across the nation, has struggled with the reality that some of its citizens don't have the means or opportunity to be as healthy as others. In some cases, a mere block separates these two worlds. Troost Avenue remains a boundary of sorts, dividing east and west, white and black, richer and poorer, healthier and less healthy. These inequalities have led to a decrease in life expectancy in some zip codes of the city. But in recent years, people from all sectors, government, business, healthcare, and grassroots groups have come together to make their city healthier for everyone by focusing on initiatives that foster economic dignity, prevent violence, and support quality education for all.
On the east side, where a lot of our African American families live, and further on the northeast and on the west, where our Latino families live, the health disparities, I think, are pretty clear and obvious.
We're interested in going upstream and seeing, well, what's creating our illness, and it's those conditions in our neighborhoods.
When you look at the access to health care, access to healthy foods, access to educational opportunities, and the ability to go out and be employed, all of those things have an impact on one's life expectancy. It's always good for the community to be organized, and we have an organization, CCO, that I think does a very good job of that. They were engaged with our minimum wage ordinance that we passed, an issue that does have an impact on health.
Now tonight, supporters who have fought for this for years are happy.
Showing the rest of this country what members of the community can get done when we all organize and fight together.
Communities Creating Opportunity, CCO, is physically located in the Kansas City, Missouri Health Department. The issue of income is so linked to how long people live and how well people live. And so we are able to connect both public health and community engagement to be able to create the scale of change that is necessary to transform lives.
So what are the kind of key next steps?
CCO has been committed to capping the rate on payday loans. With those staggering rates of interest, they are preying upon our most vulnerable working poor in our community.
What makes economic dignity unique to Kansas City is putting those two words together. We have a vision of economic dignity for everyone in Kansas City. That makes a healthier community, one that people want to live, play, and stay in.
Aim for Peace is part of our trauma team. And what happens is a patient comes in that's intentionally wounded by a gunshot, and our chaplains automatically come down to the trauma bay. And when they figure out the situations, they immediately call Aim for Peace.
Over the last few years, we've been able to reduce those homicides dramatically. The message has begun to resonate in these neighborhoods.
Aim for Peace is a public health intervention that understands that violent behavior often is passed from person to person, just like a communicable disease can be.
We go to the root causes of why it's happening. We try to prevent it in the first place. So public health has a deeper mission, a greater mission.
Shame on you parents who don't break the cycle.
So what's the status of this?
They're making funeral arrangements for the victim.
The violence interrupter, his or her duty is to begin to engage that family, give them alternatives, buy time. You gotta address the whole family to make sure there's no more shooting. It's like we're the referees of the community. I think we've contributed to a culture shift and a norm change in the neighborhoods that we've been working with. We have people thinking differently now.
Education is the best way out of poverty. In all those areas where good things are happening in education, black and brown kids are at the bottom of those lists. All those things that are happening that are not good in education, black and brown kids are at the top. We want to reverse that. Turn to Page KC is a program that's very dear to us because it is foundational.
Our goal is to essentially double the percentage of kids that read at grade level by 3rd grade. Kids that cannot read at grade level by 3rd grade are 4 times more likely to drop out before graduating high school than their peers. If kids aren't reading at grade level, they just have a lesser chance of having a long, healthy, productive life.
Thank you for letting me read to you.
You cannot drive true, meaningful community-wide health change by yourself. You have to do it with a collaborative group, because together, the business community, the civic community, the elected officials, and the general population at large can work to drive health improvement.
Kansas City never brags on itself, but we have made incredible strides in the last 10 years, and so I am very encouraged that Kansas City will continue to do the very hard work of helping everyone in the community to get the best opportunities for health.
I'm excited about the future of Kansas City. We're creating a place of vitality, of economic justice and healthiness that's unique to the Midwest. We are making the kinds of changes to make our city one that we can be proud of and that others can emulate.